If you're planning to refuse everything once you get to the hospital, go ahead and stay home.
Hey, so I'm a nurse midwife, and I used to be a labor and delivery nurse, and this isn't the take, and I'll tell you why. And I get that it kind of makes sense on a superficial level. Like, why would you go into the hospital if you're not going to accept the care from the people at said hospital? A lot of these patients would love a home birth, but oftentimes can't afford one. Their insurance companies won't pay for it, they can't pay out of pocket, so they come to the hospital and exercise their autonomy, their patient right to autonomy, and say, no, I don't want any of these interventions, to almost recreate a home birth in the hospital. Other people come to the hospital because they feel comfort by having access to emergency services, but will refuse everything else while their pregnancy remains healthy and normal. And that's reasonable, because people who use birth centers or have their babies at home under the care of a qualified and competent midwife, who are vetted and, their care is elevated if needed, those people have comparable outcomes to the same demographic that's delivering in the hospital. So if the person is low risk and would have qualified for a home birth and their outcomes would have been comparable, but they can't afford it, so they choose to come into the hospital and they refuse an IV, which they wouldn't have had if they had had a home birth, that, I think, is not that outlandish, but we definitely treat it like it is when they come into the hospital. Personally, as a provider, as a CNM, I don't want patients to not come into the hospital to see me because they're seeing rhetoric online that makes them feel like they're not welcome at the hospital if they choose to not subscribe to, sort of like routine treatment. Everyone's care doesn't have to look the same. In fact, it probably shouldn't. We should be individualizing care as much as we can. And I think it's fair for somebody to say, well, they want the safety net of having access to emergency services, but they don't want to actually use much until absolutely needed. It's our job to make them feel safe no matter what they want to do, because when we fail to do that, people end up doing something like a free birth where they're managing their own postpartum hemorrhage in the shower by themselves. That is what happens when we make people feel like they're not welcome in the hospital if they don't follow our rules. So if I'm your midwife, break all the rules. I don't care. I'm going to do what I can within those boundaries to keep you safe and healthy as much as possible.